Hello, everybody. Thanks for joining us. If you want to introduce yourself in the chat, let us know from where you're calling in and what organization you are joining us from. And we'll give people a few minutes just to start logging in and joining us. Again, thanks everybody for joining us. If you want to go ahead and put your organization name as well as your country in the chat, we can get to know each other and get to know where people are calling in from. We often have participants from many, many different countries joining us, so it's always exciting to see where you're all calling in from. And we'll just give about one more minute to allow more participants to join us. And thank you all for introducing yourselves in the chat. If you're just joining us, go ahead and introduce yourself and put your organization name as well as your country name in the chat. Great. Okay, we can go ahead and get started. Hello, everybody. My name is Melissa Montes. I'm a senior program officer on the ASAP2 project. Thank you for joining us for our part 4 of our 4-part series on strategic information. Today, we have some excellent presenters who will be discussing practical application of GIS methods and tools to guide spatial targeting and microplanning. And I will introduce our presenters shortly. Next slide, please. Just a few quick notes. Welcome to all of our local partners. If you can go ahead and continue to introduce yourself in the chat, tell us where you're from if you haven't already. Another note, we'll be using the Q&A box today to ask questions. So if at any time during the presentation or during the demonstration you have any questions, please feel free to put those questions into the Q&A box. And our lovely presenters will go ahead and answer those questions for you periodically throughout the presentation. We'll also have one poll at the end of today's webinar that will pop up on your screen. So if at the end of the webinar you could go ahead and participate that way, that would be great. And additionally, today's presentation and a recording of the webinar will be saved on the ASAP website at intrahealth.org/ASAP resources. And we will share that link in the chat in just a few minutes. Next slide, please. Just a little background on ASAP. So ASAP is accelerating support to advanced local partners. And our aim is to rapidly prepare local partners to have the capabilities and resources to serve as prime partners for USAID and PEPFAR programming. We have 2 strategic objectives. The first is to strengthen local partners to comply with regulations as they transition to PEPFAR funding as a USAID prime partner. And the second is to prepare local partners to directly manage, implement, and monitor those programs. Next slide, please. Some key results from ASAP 1 and 2. ASAP has supported 126 local organizations in 18 different countries. 113 of those have been local partner organizations, and 13 have been local government partners doing some G2G support. Next slide, please. These are a list of the ASAP supported countries. The countries listed in bold are countries that we are currently supporting in ASAP 2, as well as some additional ASAP 1 countries that we're no longer working in. And many of you are from these supported countries, so thank you so much for joining us. Next slide, please. These webinars, we've done about 90 webinars so far with more than 20,000 attendees in 76 different countries. And most of those webinars can be found on our ASAP's webpage, which again, I'll share a link in the chat in just a couple of minutes. And the presentations as well as the recordings are available there. Next slide, please. Most of our webinars are available in 3 different languages, so you can filter on the website based on language or topic. And we do our webinars in French, English, and Portuguese. And when we translate those webinars, the presentation as well as the actual presentation is translated into that language. So if those are your language of preference, that is an option available to you. Next slide, please. On the website, you can download a PDF of the presentation that you can share with your colleagues to continue learning, as well as watch a recording of the webinar. And again, those links are all shareable, so you can go ahead and share resources. Next slide, please. I'm excited to announce today's presenters and to introduce them to you. Dr. Dorman and Chimiwa, as well as Victor Bangwambo today are joining us from Right to Care, and they will be leading you and guiding you through the rest of this webinar. So we're very excited to have them with us. And Dorman, I think, is going to start. So go ahead and start for us, Dorman.
Thank you very much, Melissa, and good morning and good afternoon, colleagues. It's always nice to meet and be able to engage and discuss on interesting things that include GIS. I'm not going to spend much time introducing myself. I think Melissa has already done that part. I will delve straight into our presentation for this afternoon and this morning. To get us started, I want us to focus on the 2 main areas, just to explain a bit more what we will be doing in this webinar. 2 main broad objectives we will cover. The first one, looking at just orienting the participants, you, on some of the GIS systems and tools that you can use for your spatial targeting and your micro planning. Once we have done the first session on orientation, we will then move to the second part, where we will do a presentation on a practical example, just to show you how to set up, how to analyze, how to visualize and use your GIS systems for decision-making support. So to get us started on objective number 1, I will be covering about 3 main broad areas before I get to the examples. Firstly, I will talk to why GIS. We have been analyzing data using multiple approaches, so why GIS? The second part is then we will discuss how to define your geolocation. If you have got points of interest, you want to adopt your GIS systems, how do you define the points of interest from a geolocational perspective? Then thirdly, I'll move to some of the basic approaches into setting up your GIS systems, how to talk to data collection, integration of locational and non-locational data in a GIS environment, as well as analysis and visualization in support of enhanced program implementation, data targeting, and micro planning. And then we will jump into some practical examples just to show you some of the work we have done with GIS systems, predominantly using the ArcGIS platforms. After part A, Victor then will come in to look at to take you through a practical GIS demonstration, and then we will group on a QA session. So maybe let me start here. Why GIS? And I guess the answer lies around a number of key arguments. GIS tends to give us a leverage and advantage when we are trying to unpack a number of problems, especially when we focus on geography. Firstly, GIS gives us a better tool, a better way to illuminate problems. When you want to identify problems in an operational area where you are providing services and support under USAID, you want to understand and make sure that you identify your problem. GIS is one way that actually helps you to amplify and understand the magnitude and the where elements of the problem. When you want to monitor change and visualize that change, this could be probably from a monitoring and evaluation point of view, or you just want to see where impact has come through, the monitoring of that change, location, GIS becomes quite central. Management and response to events. Our situational awareness is actually driven in most cases by a number of support mechanisms. You could have your Excels that you are using to understand how things are changing and how you are responding and managing those changes. When it comes to GIS, then it gives you the spatial element to actually be able to have a different way of understanding how these the events are unfolding and how you respond and manage those unfolding events. And in most cases, we can actually do this in real time, and we will show you some of the examples in that space. What if scenarios? You want to forecast, what if we do activities this way against that way? Again, if you want to explore that in a locational manner, GIS will be key. Setting of priorities and understanding of your trends. When you visualize trends, the power that comes with the visual representation, where you place location at the center of the visuals, that definitely comes in very well in a GIS environment, and you will not be able to pick that up, say, in an Excel spreadsheet or other environment. So these are some of the reasons why you find we are saying why GIS, and we will delve into some of those illustrations a bit later. But maybe before we get into the details of some of the presentation we have, we probably want also to know you better. So using this meeting chat box, we would like you to write down the kind of work that your organization does. And you can just give us 2 words: nutrition support in Zimbabwe, adolescent girls and young women in Burkina Faso. Those are examples. And I will pause and just allow you to put some of those ideas in your Q&A. Please go ahead. Yeah, thank you. I'm starting to see some of the work that you are doing. I'm seeing the TB HIV care in Zimbabwe. Any other participant who wants to tell us what area they work in and which country they work in? Just type that in the chat box. Thank you.
Yes, Dr. Domen, there are some responses that's been posted in the web chat, in the chat window. It's quite a number of them. Not in the Q&A one. Thank you.
Thanks a lot, Victor. Yeah, I'm picking the up now as we go. Thank you very much. I think it's very interesting when we look at the landscape in terms of where we work. And obviously, we then come back and ask the question, how could we be adopting using GIS systems, support and solutions to enhance our implementation, to target better, to plan at the lowest level. So let me take you through some of the building blocks around which we have structured this webinar. Firstly, I think one of the key areas that you need to make a decision upon. Let me pick the example of HIV program support in Mozambique or food distribution that I've also seen as a support area. You have to make a decision. You have to decide what kind of geolocational information are you going to collect. And this is important because at the end of the day, by knowing what you want to spatialize, by knowing what you want to understand from a geography point of view, you actually now can set out your data collection methods and systems in a very coherent manner. I've got examples here where on your left, you are seeing some of the examples of program support areas and the GIS that are data sets that we could resultantly collect. A good example, a partner is working in the health system strengthening space, another partner working in nutritional support, emergency response, or you are running a school-based intervention as an example. A good example, if we look at the TB treatment support that we also saw in the chat, the question is then what geolocational data would you need to define for you to be able to support your program better in terms of micro level planning, in terms of targeting? A number of things. One, your GPS coordinates are so central. When we define geography, coordinates are one piece that we have to put at the center. The second area could be our addresses, where we say, where are our clients or our customers in terms of the suburb, the settlement, the town, maybe even at the lower level, at the street level. This is information you can define. If you are working in a rural area and you are dealing with villages or settlements in rural setups, you might also want to define that in terms of which villages are you operating in, which settlements are you operating in. Activities that are centered around a point where care or services are provided. This could be a nutritional program where you are doing school-based nutritional services, or this could be a health facility where you are offering services of a variant nature from TB, from HIV, or all other related healthcare services. Landmarks can also be key there as a geographical point that you can use to define your services. You also have your mapped points, which could be typically village-related points of care. A good example, you could be offering services at the village headman's homestead. You could also be offering services at a water point or any other defined geographical point. Then you need to actually understand the geography, the where of these various elements. You could also be defining geography in terms of service routes that you are working upon. Say you are strengthening services in a laboratory setup. You are strengthening diagnostics or something related to that. Then the route and route management of your specimens from point A to point B become critical. So these are some of the program areas on our left and the way we would want to define the geography associated with that on the right. With that defined, I think once we know what kind of geolocational information we want to collect, then probably the next conversation moves to how. And the how could be answered in multiple ways. At the basic level, you can build a very simple system where geolocational information plus your other critical information can be collected by your field workers. This could sit on one tablet where you can code all your questionnaires or questions, plus you then ensure that the geographical location is also captured on that device. That can also be extended or strengthened to include a team where various team members are in the field to actually collect information. Beyond that, you can also even have multiple teams based in multiple locations accessing your GIS infrastructure to collect information. And there, this is now where you say, what front end do you need to be able to do that? And what back end do you need to be able to do that? So you can have single gadgets, you can have online GIS solutions, you can have server-based GIS solutions, depending on one, the need, two, the resources you have, and how much you want to scale that beyond where you are. Also, what is interesting and important these days is obviously online and offline data collection, quite key, because when you are online and your teams are in the field, GIS solutions results can be synced into your servers directly without you having to worry. So you literally get your data in near real time. So with that data collected using that different arrangements of your data collection approach, you are able to, number one, get the downloads of that data. So if I have a single gadget or a couple of field workers with devices, they should be able to download that data directly, probably to their laptops in an Excel spreadsheet and then share with the central office. Or these, if you have got the more complicated systems where you have your gadgets linked or synced with an online interface, like your online portal, online GIS server, you're now able to actually receive all this data directly from the field as your workers are going around. So with that data sets downloaded, structuring, obviously, formatting and cleaning of that data, we all know it's critical when it comes to data sets. One thing that we know particularly with GIS is that a lot of coordinates sometimes could be a problem. So you pull that data into the GIS systems that you are using. It could be QGIS, it could be ArcGIS, it could be any other GIS environment. With that pulled in, you integrate the data, non-spatial with spatial data, and you are now able to start doing your analysis. Simple analysis you start with simple, you could do complex analysis depending on the need, and then obviously you strengthen your visualization. Right, let me jump into the first example, which is HIV related. And I think people who are working in the health space, I'm sure you'll be able to follow on this example. As we are striving to reach epidemic control, especially with HIV, in line with ensuring that 95% of our populations know their status, i.e. the testing part, first 95. And then of the 95% that know their status, which is HIV status, we want them to remain in treatment, the second 95. And then of those in treatment, we want to ensure 95% of those, they have their viral load suppressed. So you have first 95 testing, second 95 treatment, third 95 viral load suppression. How could we bring in GIS to support this? Many different ways. The first 95, of course, the issues around hotspots. Where are we having more positive tests in the community or even at the facility, so that we are actually able now to say, where should we be focusing our efforts? It's very easy sometimes at country level to get all your foot soldiers all over the place, but then the minute you start putting numbers to facilities, then you have facilities to focus on. And the minute you start unpacking differences between the facilities and the communities, then you also have communities that to focus on around that facility. First 95. Second 95, which is treatment. This is now where we say, where are we losing patients? Where are we having all our patients that are taking ART all these patients are remaining in care. So you can now start looking at patterns of your loss to follow-ups, and then you are able to define the geography around your loss to follow-ups. This could be in your TB program, this could be in your HIV program, even this could be also in your COVID-19 vaccination, where you just want to say, where are we finding people that picked up the first dose, but they are not coming through for the second dose or for a booster? So the treatment related GIS analysis could help you that. Suppression is simply to say, we want to know where all our patients are in treatment and where they are remaining in treatment, so that we can start devising mechanisms to keep them out of facilities where they can go and get their meds from pickup points, from CCMDDs, those kind of things. All these issues can be spatialized, and we will walk through quickly some of those examples. So let me start with the testing part. On my top left, I'm showing a facility that is testing clients. And you can see the geolocational element positions where these clients are coming from. By the way, let me be upfront here. We will geomask these coordinates for purposes of protecting our patients. But here I'm using this as an example for you. So you are able actually to see where are we getting patients and where has testing been done. And on the bottom left, you are also able to say, where are we seeing high number of testing with high yield? That way, then you're able to say to foot soldiers, keep going to those places. And where we are seeing high number of testing, but with low yield, then maybe we can say, you know what, let's remove our resources and direct them elsewhere. And same with this slide, where now we are trying to connect what is happening at the health facility that is supporting our patients who are coming from the community. You also want to see the geography in the community. Where are we having testing that's giving us good results versus where are we getting testing that's not giving us good results? That way, if you've got community health workers who are going out and recruiting patients to bring them into a facility, you also know the geography of the area, and you're able to strengthen your interventions. A third area that we have been discussing and promoting as GIS is participatory mapping. Participatory mapping, especially when we are approaching the 95, 95, 95 in the HIV cascade. One thing we are realizing is that there's quite a lot of information that our foot soldiers, our communities know about the area that we don't know. We can go to the statistics office, we can go to the health department, but people in those spaces will not know about the local area, the hotspots, areas where there are congregates, areas where there are key pops, or where they tend to hang out. So participatory mapping helps you to harvest information that's in the minds of our local residents, the CHWs here, I mean community health workers, and everybody who lives in an area. How are those health facilities perceiving their population? Where is the catchment area? Where are your key pops? Where are the community testing being done? And where do men hang around in my local area? All these questions can actually be held by doing PM, participatory mapping. And some of the mapping here just shows you basic approaches where you have a hard copy map as a basis, and this hard copy map is put before a community, before your community health workers, and you ask them the questions and they will run with it. With that map now full of all those points, you are now able to bring that into your GIS environment, and you're actually able to have a starting point in terms of planning your next set of interventions. Another example of how GIS has been used, and this is talking to large-scale deployment. This was work that was done in Zambia, where the ask was to map about 2,500 health facilities in Zambia in 10 provinces. And this assessment was targeted at a number of things. But the main idea was that we want to scale the viral load systems in Zambia. And for us to be able to do that, there was a number of GIS data sets which you see on the right in blue: clinical data, census data, roads data, admin, hydrology, and topography. A tool was then developed, which you see in the middle there, which was placed in the hands of field workers who went around in the 10 provinces and mapped all the 2,500 facilities. And this was done to actually answer a specimen movement question. So what you see now is the map of Zambia. And I think the conversation here is, from a data collection point, you will see that there were field workers that were given numbers, right to care 1, right to care 2, right to care 3, 4, 5. These field workers, as they were going around, we could actually see where they are and how they were going around, as long as they were in a network area. And this is the advantage of online deployment of GIS solutions. And on the right, you can see top right, a dashboard that talks to some of those numbers, how we were able to pull the results from that survey directly in a dashboard that was sitting in an online GIS environment. We could see which facilities had computers, the facilities with internet connectivity, cell phone connectivity, how was the source of water by facility, as well as the fuel. And at the bottom right, we were actually able now to start developing our specimen transportation model by picking up, identifying hubs that are in existence and new hubs that could be added to enable better specimen movement. And you can see some of the facilities there. So all built in a GIS environment, and just to show you how this could actually work out. I'm going to jump into another second set of examples before I hand over to Victor. Here in this second set, this is more recent interventions related to COVID-19. And I think this is something that we are all familiar with. I will give an example of South Africa and how GIS helped in terms of directing activities and ensuring that additional support is guided and directed for micro level planning. At the basic level, what you see is a map of South Africa as a country, and you see that the areas that are in dark red, these are areas as of January 2022, they were having very low vaccination coverage. So because of that, the government made a decision to say, we want to use resources that have been put on the table by supporting partners to ramp up vaccination in those sub-districts. So the ones you see in red are the sub-districts where coverage was very low. And then we'll show you some of the works that we were done. What then we did as support mechanism to this intervention was we started building a GIS system from scratch to strengthen the entire implementation of vaccination program in South Africa for COVID-19. So the starting point was to build systems right from scratch, covering the entire country. Multiple data sets were pulled up, and you see the very center, number one, GIS dashboards were built using population data. We pulled all the clinics that are vaccinating in the country. We pulled all the schools that are available in the country. We also pulled the settlement data up to suburban level. With that, we were able now to start adding numbers that are critical for the vaccination program in the country. Numbers such as the age groups that were being monitored. A good example, the 12 to 17 vaccination, how is it performing? 18 to 34, how is that performing? 35 to 49, how is that performing? 50 to 59, how is that coming through? And we were able to attach these numbers to the local area. What it meant was that GIS was able to be used at the lowest level to plan for a settlement, to plan for a suburb. So on a Monday morning, what would then happen is a team would sit down, log into these live GIS systems that were built for COVID-19 vaccination. And they are able to pull from these systems the worst performing wards, settlements, suburbs. And these are worst performing either by age group, worst performing by all age groups, And with that, they are now able to say, for this week, where are we sending our foot soldiers? With that data known and the location where the poor coverage is happening also known, then the team could sit around the table with either the soft copy or hard copy map and have a conversation to say, Team A, you're going into this area. Team B, you're going into this area. And Team C, you're going into this area. Now, I know that multiple countries have done vaccination in multiple ways, but for the South African example, what was the main process was that before we send our vaccinators out to do COVID-19 vaccination, we would send our teams to generate demand. So you have people going out with loud hailers and telling residents that on this date, vaccination team will be in your local area. We also had a tool which was showing where vaccination was happening. That tool is called Find My Jab. So at any given time, a resident, a community member, a member of the public would log in to Find My Jab, check in their local area and see where vaccination is happening within 10 kilometers, 20 kilometers, 30 kilometers, and also see when local vaccination will happen. When I say local vaccination, I'm talking of vaccination where the vaccines are being brought to the people in the local area versus where vaccination is happening at facility. So with that information known and the coordinator having all that information on the table, they're able to send the demand creation team with a tool which we call the Social Mobilizer app. And again, this is a GIS-driven tool. So the demand creation team would be able to say, coordinator, we have gone to this place, that place, that place. Here there was demand generated. There are 50 people ready to vaccinate on Wednesday. Here we've met 25 people. All 25 are hesitant. All this was built in the GIS system. Once that demand has been generated with online real-time view by the vaccination coordinator, then they're able to plan with the nursing team now, the actual vaccinators, to say, demand is generated. We have promised our people that on Wednesday we're coming through. Can we now take our needles, take our vaccines, and we go and vaccinate our communities? The vaccinators will now go with a second GIS tool, which is called the daily vaccination tool. So what these guys will do, because the demand creation team has dropped a pin where they have generated demand, the vaccination team will go exactly to the same point to mop up that demand. And once they've finished mopping up that demand, they will capture the information and it's pushed back into our GIS data dashboard. That way we were able to track in real time what is happening with the demand generation. Where have we generated demand and not picked it up? And where have we not? Where are we getting hesitancy? And how do we then put together messaging, communications material to address issues of hesitance? So all this is just talking to you on how GIS has been pivotal, central in the way we have deployed our support for COVID-19. Here I'm just talking to the way we have triangulated all this data from the vaccine coverage, which is hosted in the dashboards that you see as provincial dashboards, the social mobilization work, as I said, sitting in the social mobilization app or through the social mobilization app, and the vaccination tool, which I said was in the hands of nurses. All these systems are linked as one. And the reason why we link them as one is because it's all about one activity. GIS being at the very center, GIS illuminating the problem in terms of coverage, and then GIS being used to guide the implementation of the entire vaccination. Right. This is also other information. When we moved from a community-based focus, now we have moved towards a facility-based focus, where we are now integrating vaccination for COVID-19 in routine healthcare services. So one step which was critical for that was to say which facilities in which district, which province, which sub-districts are going to be the facilities where we're going to integrate COVID-19 vaccination. Once we identify those facilities, we are able now to do assessments of those facilities to check their readiness for integration. And these are assessments that cover a number of areas: supply chain and all activities related to supply chain and storage of vaccinations. Do these sites have the nurses, and do they have adequate nurses who are going to vaccinate everybody that comes through? Demand acceleration, are we ensuring that we don't miss the opportunity to vaccinate people that are willing to get their jabs? And I think what we have seen with COVID-19 is that if you miss people coming through, and if you don't have a no missed opportunity model, the minute you miss them at the facility, you will not find them coming through again. So this is one tool, again, built in a GIS environment where location is central, and we're able actually to guide the assessment of our facility in terms of readiness for vaccine integration. And these are some of the dashboards at the back end of it that just shows how, one, from an M&E point of view, you can pull all this information, and you're actually able to make decisions to say, hey, we have picked facility X as an integration site. Where are we? Where were we with this site back in Feb? Is there any movement traction? Why is this facility remaining flat in terms of performance? So it gives you that whole M&E spectrum that you can be able to look at as managers and also craft your necessary interventions. So you're actually able now to, as an example, put together a quality improvement plan based on the assessment that you are seeing and the refreshes of these assessments. So this is some of the work that we have done. These are some of the examples that we can talk to as far as pivoting and leveraging on GIS is concerned. But as I said, I think all it takes is starting modest with 1 gadget, 2 gadgets, and then scaling up depending on resources. It's all possible. Rome was never built in a day. We start small and grow it. I'll pause here, and then we will jump to Victor to take us through the second part of the presentation. Thank you. Victor, are you ready?
I'm ready, Dr. Doman.
Yeah, over to you.
Yes, good afternoon, good morning, colleagues. I will just quickly take us through a practical session where I'm going to demonstrate just an overview to begin with of what GIS is for colleagues who might be confused. And then we're going to touch on some of the examples that Dr. Doman did highlight. So while I'm going through this, let me just share my screen. While I'm going through this, I am going to use this particular document, which we also share at the end of this, so that colleagues can be able to go back and refer back to some of the examples, some of the points that we've pointed on. But essentially, the outline is that I'm going to cover 3 things. Just a quick overview of what GIS is. Dr. Doman did a wonderful job of covering all those different points that I have on here. And secondly, we're going to jump into just an example of an ideal situation where you can use GIS to answer specific questions. Remember, a lot of times when we're talking about GIS, we tend to think about maps, but there's much more that actually can come out of that, the maps themselves. As you might have seen, when we overlap different resources or different data, we can actually end up creating new data set. So we take data A and B, and we can come up with a different layer of information. And then thirdly, I'm going to demonstrate some of those tools that Dr. Doman did highlight that we've used for COVID support. Okay, so just to begin with the first section on an overview of what GIS is, I would just like to stay on this slide to begin with, where I'm just talking about what is GIS, because I did notice there was also a question asked about what GIS is. But essentially, GIS stands for Geographic Information Systems or Science. And in essence, it's tools that basically allow us to analyze, manage, and visualize geographic data. That is very important. That essentially is what it is. You're managing data, you're analyzing the data, and then you're visualizing the data in a geographic way. So you can have tables in your data. You can have data sets in a geographic format, which I'm going to demonstrate three types of them. So you have your points, your polygons, and polylines, as well as tables. Okay. So, but what you will notice here, and again, we do talk about data preparation, manipulation. When you're talking about preparation, manipulation, it's part of managing the data. You can have data sets where you need to add up certain values and it gives a specific value. That's manipulating or managing your data set. What's very important here is that we need to understand before you use the GIS to understand and define the problem. What are you trying to achieve? But one of the most important thing is that how important is location to what you want to do, what you're trying to do. And then you need to understand the data needs. So we're talking about what data set do you have available to you. So you have to explore the data set, whether you've downloaded it, you've created it, it's been shared with you. You need to explore it and see, can then it allow me to answer some of the questions I'm trying to answer? Okay. And then if you have specific data that's missing, you need to figure out then how do I source this data? Can I create it myself? Dr. Dorman did cover some of these things. And then thirdly, I think one other thing that's quite important is the software that you're using to do that. We're using ArcGIS predominantly, but also we tend to use QGIS quite a lot. There's a few other open source resources that one can utilize, and then other resources that are web-based, where you can go and exploit data set in a geographic sense. So I've given one example here, which is your QGIS, one of my favorite open source resources. This is the link. You can go Google this on Google, and then you should be able to get the results. But before we do that, before we go to the second part, I want to quickly just show you, highlight this point here, especially for colleagues who are new to GIS. I will be using ArcGIS. So I've already loaded certain data set, but let me bring data set into this environment for you to see how easy it is to actually use this. We are literally playing around with data set. And when talking about data set, remember you can have this data set, like I said, as a point, polyline, polygon, and tabular data set. There's other formats you can use, but I'll just stick to those three. So here I have four different types of data sets, covering those four different data sets I just mentioned. Point, polyline, which is a line like roads, rivers, and so forth. We have what you call a polygon and the tabular data. So you notice here, some of this data is in a GIS format. You see the first record here, which is schools.something, schools. So all this in a GIS software is regarded as one file or one dataset or a layer of dataset, so to say. This one here, I've mentioned 2-point-something, South African roads. That's also another second shapefile. So on your Windows Explorer, this is how it's going to look like. And then thirdly, at the bottom, I have one that is a tabular data. So this is your typical Excel file, but you'll be very surprised how much data set we can manipulate and create using this sort of resources. And if I open this data set, I'll quickly highlight, we'll give you an example of what I mean. Okay, so essentially what we have here, we have demarcation data for South Africa. You have a province, district, sub-district, and then we get into something called a main place name or a village or a town or a city. Then under that, obviously, usually you get your suburbs or your settlements or your villages. And in each one of these villages actually has a unique identifier. That's how it's done in South Africa, but I think in many other countries, that's how it's done. A unique identifier is given so that that particular geography has got a unique identification. If I have this data set and I go pull census data, I can be able to attach it to this, okay? Remember, like Dr. Dorman did mention that we can use coordinates, addresses, so where we're doing geocoding and so forth, to find out where is this located on the map. And with that, if we're able to attach additional data, such as census data, education data, you name it, we can be able to enrich the data set. That's the whole process of manipulating the data set to managing the data. So here we have our initial table. We're using these two fields, and then we're now able to combine the two data sets. And you notice this data set has your gender, race. In the case of South Africa, we have quite a diverse country. And then we also have age groups by the different, breakdown of the different age groups, how many people. And then if I move further to the right, you notice the data has been enriched by calculating predominant gender for that settlement. Remember, each record here represents a settlement or a village. Predominant age group, total population. So I can add up all these fields to end up with that total population. And also have a description whether it's a village, how is it defined? Is it the village, is a built-up area, informal settlements, town, villages, you name it. There's different categories that you can decide to use or that's been defined for you. And it's further to the right, these are defined by gender and then also specified specific age groups. So here you notice W for female and then male. So I've selected the age groups of 15 to 25 to 24. So that's all derived from these other fields here. Okay. And then also for male and then for forecast population, I've basically added a column, this column and this column to get that answer. So we are manipulating the initial data set, census data. And I'll show you later on how we can use this to go and answer specific questions. All right, now let's come back to our map here. I just want to demonstrate the whole concept of a point, polyline, polygon, and table. Okay. Remember I said that this data set, this is your GIS data set, and then this represents one layer. But I can actually simplify it within a GIS. I can visualize it like this. So where we have, you notice that icon you have there with dots, that's your point. So your schools are represented as points. So the location of each school is represented geographically as a point. So you also have your polyline. You can see that's a line, that's your South African roads. And then districts and then suburbs. And you can have a whole lot of other data sets that you can actually use. Matter of fact, some of the data set is freely available online, and I have provided some of the few resources where you can go and Google, for instance, whatever you want. Shapefiles is another name we use for GIS dataset. Okay, that's a format. And then I've shown examples of some of the different areas where you can come and just download freely available or shared GIS dataset. Okay, so let's go back to our GIS softwares here. So demonstrating the different files, how they appear within the GIS environment. Remember, this is how we see them in your Windows Explorer, but it's just simplified here. So you don't get to see a repetition of different files that don't make sense to you. Okay, so the software is just telling you, this is a point layer, this is a line layer, this is a polygon layer, this is a polygon layer, and this is a tabular Excel layer. So I can actually here, I can go and create a preview. The point layers are going to be points. This is what they look like on the ground. If you are to map them in a GIS software. And then you have your roads, which are lines represented as lines. And then you also have your polygons represented as an area and enclosed line. So that would be used to represent it, your country or national level, districts, provinces, sub-districts, you name it, whatever word that's used in a specific area. Same thing for suburbs, you notice that's a bit more detailed. And then for the table, I will not be able to visualize it because that's an Excel file. So I'll actually have to access it by Excel or change the format for me to start visualizing it within a GIS. All right, so now going back to my GIS software, we have a map. Very easy. And I'm going to quickly show you how we can manipulate the three data sets to create a simple map. A map that you can now take, put it in a report, a map that you can put in a report or print, and you have a hard copy map, like Dr. Domen did mention that we print out map for participatory mapping. Okay, so I'm going to add the different layers, the data set that I've just demonstrated to you. So it is the schools, which is a point, South African roads, which is your lines, and then I'll add these other two layers here. Okay, just to not affect the performance of my PC, let me just turn off the background. Okay, and I want us to have a look at this data set put together. So GIS basically allows you to take all the data, put it all together. You can have hundreds of data, but it's just a matter of how do you now manipulate it to convey a message that you want to communicate. So I can now zoom in. This is live data, the same data set I've shown you. And you can see right at the top, you have your schools, you have roads, and then you have your polygons underneath. I can change the order of this, but notice what happens if I take the schools and put them under the polygon. You no longer see them, and that's because the layering of those layers. Okay, but let's go back to the schools again. So this is for a province in South Africa, and what I would do is I can change the symbology of that point, okay, the point layer, and just make it more presentable. So I can choose any symbology I want to use. Okay, and I can zoom into a specific area, and then I can say, please label this for me. I'm just gonna apply a label. Okay, just trying to make sure I can see the top of this. And with the labeling, I can say, I actually want to see the school name. Okay, so that's that's how our points are going to be labeled. If I zoom in, just give it a few more seconds, I should be able to display the labels of those schools, and then I can bring the background again so we see geographically the context. Where is the school located? You know, is it a suburb? Is it a village? Is it so? You name it. Okay, so that's basically how you come and manipulate data within a GIS. Also, the same thing with the roads. I can change the symbology. I can change how I want my roads to look like. Okay, so I have basically control to choose how I want my map to look like. Okay, so I have my schools displayed here. And then one other thing we can actually do, behind each GIS dataset, there's usually what we call an attribute table, which is the information behind that GIS data. Hence, when I'm saying label those schools, it's actually pulling it from this table. So each record here represents each school, as you can see, is the dot. And you can see it's got unique identifier, which province it's in, the official name of the school. And this, when I'm doing the labeling of the layer, this is basically where it's coming from. And if I move further to the right, you get to see other things such as GPS coordinates. This is now how this data was actually mapped into a GIS because of these two columns that were provided. And then we can also see things such as the number of learners each school has, okay, if that has been populated. So already you can see there's much more that we can start doing because you have data set embedded within this particular data I'm showing you. So within a GIS, we can create a map, and that map can be printed out, can be put in reports. Just to give you a quick example on how to do that, I will just touch on that quickly on the second example of the demonstration that I'll be showing with you just now. Okay, so yeah, that's basically the description of the three common type of data sets you have in a GIS. Okay, so we've just covered pretty much this section here. Now let's go to the second one. Okay, the second one, I'm saying that I'm just creating a case study where we are mapping and analyzing potential spatial patterns of HIV risk based on study findings in a specific scenario. So the scenario, we got it from a journal article, and you can see the heading here. So this is related to HIV. And the article was saying sexual partnership age pairings and risk of HIV acquisition in rural South Africa. Okay, so you can read the abstract, and then some of the key things that came out of the study was the following. I have highlighted them as such. So where they found out that HIV incidence was highest amongst the 15 to 24-year-old women reporting partnerships with males between the age of 30 to 34. Okay. So in conclusion, they actually made a statement that says age of sexual partner is a major risk factor for HIV causation in both men and women. And partner age pairing plays a crucial role in driving the cycle of HIV transmission. So with this sort of information, I know we're just looking at this as a scenario in this particular example. We can now say, from a GIS perspective, let's analyze and explore spatial patterns of HIV incidence based on the findings above for women between 15 and 24, and the men between the age of 30 to 34 within a specific geographic area. I'm just choosing this because we had data set that's speaking to these two age groups for the both genders. Okay, so with that said, let's just move down. The first thing you usually want to do is really to understand your data set. So what data set do you have? Do you need to create a new data set? Do you have census data that can be able to allow you to understand or answer the questions you're trying to answer? So the first piece here we have is your settlement boundaries. We do have that. We have health facilities, and we have other additional data such as district and sub-district boundaries. But let's touch on the first one, which is your settlement boundaries. This data set has age, gender, location attributes such as population. It's the same data set I was actually demonstrating, where input from census data, and we are able to break it down and say within this specific settlement, there is X number of this age cohort and that age cohort. And we can be able to classify each of those settlements, whether it's a village. So in our case, let's define rural areas, okay? In the rural South Africa, as it did say here. We're gonna use the class that's called village as a rural area. I know there's a few other ones here we can put into that classification, but let's just stick to this one here that is rural, okay? All right, so now let's explore our GIS dataset. Okay, I'm gonna go back to our GIS and I'll switch back to this map. I've already loaded the dataset so that we don't have to go out and find it. And the first one you're going to see here is your health facilities, okay? So I'm just gonna zoom into that so you can see what it looks like. It's around in the province of KwaZulu-Natal, around the city of Durban. And if I switch on this, it will show us the boundaries of the settlements. In this case, it's suburbs. Part of this metro are also considered to be rural, okay? And all this is contained within this eThekwini EA or enumeration dataset, okay? So if I switch it on, you will see those classification and showing village as well. Again, if I open the attribute table of this layer, you notice it has exactly the same information I've displayed in the Excel file. Okay, so all this data set, all this, remember I said that I had actually derived this myself. I went and added up from the census data set. So I've already enriched this data set, okay? So meaning also, I went and derived or attached to this shapefile, which is your polygon. I went and attached the information about the primary land use, which is, so now I'm able to actually symbolize the layer based on the different land uses. And with that, I'm able to highlight areas that are considered to be rural areas in our particular case. So remember now, let's go back to our document here. And I'm just gonna go through each point by point at least until we reach here, okay? So the first point I'm mentioning there is how can we best represent this data, especially in the context of the aim outlined above? Can we identify rural areas from the eThekwini metro? We can do that because it's within our attribute table. But basically, how I did this, let me just take us a step back. so that I show you how we work to visualize those settlements or those village areas. The raw data set looked like this. Okay, this is what it looked like. But if I open the attribute table, it actually contains further information that we can use to enrich the data. And basically all you do, it's the same thing you are able to do in GIS, is that you are actually able to go and, just give me a second, so I can shift this. You are able to go and, your raw data, when you load it, it's going to look like this. But I can actually be able to go and manipulate the data set based on the attribute information. So you notice every time when I change, you can use different types to symbolize your data set. I can now go symbolize it based on that field or the column that says primarily land use, which is this one here. So when I select that, automatically it's going to now pick up those different categories. And you can see they're all mentioned here together with the colors. Each one of them is used to represent. I can change the color of those if I want. Okay, so that I highlight maybe those specific areas more clearly. Let me change it to that light blue color. And when I apply that, I'm now able to see where those rural areas are. Okay, so it's as simple as that. You just play around, you click here, click there, and things change. The second thing I want us to look at is symbolizing our data set to visualize your population, the age cohorts that we're talking about. Okay, so we can do a general data symbolization, which will allow us to be able to say where is the largest population for the two age cohorts. Okay, so how we do that again? I go there and then I change my symbology based on, let's use graduated color. So basically what that does, it creates classes based on a number. If your table has fields or columns with numbers, so we were able to say, highlight the largest at the top and the smallest at the bottom. The same way we're able to do conditional formatting in Excel, basically, where we're able to go and say, apply this sort of scale. So whatever that's large, apply it to the green color and so forth. We're doing exactly the same thing, just in a geographic sense. Okay. So here I'm able to now go find, remember there's a field I have in my table here that talks about total forecast population. So I'm going to apply it here. So I'll go find it right at the bottom of the table, total forecast population. That's what I'm symbolizing my GIS data on, based on. Okay, let me switch on that layer. And already you can see whatever that is dark red, just minimize that. That's where you have the highest concentration of that population. I know some of that information is a bit hard to see because how small some of the settlements or suburbs are here, okay? But I can actually change how that is being displayed. So I'm able to go say, let's format all symbology. I'm just trying to change the outline. You notice each polygon has a boundary, which is an outline. I'm just changing that to 0 point. It's a matter of playing around with the data set, and then you get to see a picture you might be interested to see. So from this snapshot view, I can already see this part here of the metro, and then this part of the metro, which also happen to be the same rural areas that we had identified earlier on, seem to have a high population of the two age cohorts that we are trying to look at. So in other words, they have a high population of the 15 to 24-year-old female, and then a high population of 30 to 34-year-old males. Okay, so we have been able to actually identify using that symbol, a simple symbolization of our data set. Okay, so we're using the simple graduated colors. We can also use proportional symbology. So in other words, what that means is, let me make a copy of that. I don't want to lose that layer, and I will switch off that layer. Okay. And what I want to do is to change. I'm just trying to demonstrate a different way to visualize this data set. So instead of saying graduated colors, I can say for each one of these, just use proportional symbols. So in other words, based on the number, it's going to equalize our table to have dots or bubbles. Okay, the size of the bubble is going to represent the relative size of the population. Okay, so that's a bit too high. So it becomes a bit too busy because again, this is a small geographic area and the population happens to be very high. So just minimize the size of those bubbles. And one other thing I want to do is maybe zoom in. And then I can change how big do I want my bubbles to be. Let's just choose a value of 20. Doing what I wanted to do. But one other thing I want you guys to notice, because this is an urban metro, so you are going to have a lot of bubbles that seems like they're clustering or sitting on top of each other. But you should be able to notice that each bubble move towards the rural areas. Each bubble represents a relative, it's sitting within those borders, which is borders of those settlements. And each bubble represents a relative size of the, proportion of the focus population we're trying to look at. So here where you have large bubbles, actually means you have got relatively high population. It's a similar thing if I use this sort of styling. So where you see your red is your high population, as you can see here. And your yellow will be where you have your relatively low population. Okay, so let's go back to here and then move forward. So we have symbolized our total population, but remember again, we can actually apply this for the different age cohorts that we have. Since we have your female 15 to 24-year-olds, when I select that, you notice that the colors also do change. Okay, so I had created some of those symbologies earlier. So let's just group all our data sets so that we don't have too many copies. And then what I did was just to rename the layers so that I can rename the layers so that the layers we have here are descriptive. Again, we're still using the same GIS data. We're just making a copy of it, changing how we want it to be represented, and it shows us different information. So we can come here, apply the same symbology, graduated colors. This is for female. So let's choose that field that speaks to female. And then we can go pick the one for male again, symbology, graduated colors. And again, what we want to do is to pick the correct field that speaks to the age cohort. And if I zoom out, we currently have two layers sitting on top of each other. Okay, I'm going to switch off the top one and notice the pattern that changes at the bottom. I'm hoping you guys are able to see that. So visually, you can see there's some sort of differences between the two layers. So one is saying, for instance, this area here, the two populations are quite high. But for female here, also you have high population here. But for males, that's slightly low. And to the south, it's a similar pattern we're seeing again. So we can take this a step further because right now we're busy combining the two layers, and it's a bit tricky to try and, unless if you create two separate maps, a bit tricky to try and look at these two layers. Yes, they're coming from one layer, and make sense of it because you now have two layers. So we can actually take the two layers, put them together, and try and get more meaningful data from the same data set. And that's exactly what I'm going to do on this third layer here. Okay. So what I would do here, as I've mentioned in the Word document, I'm using a different symbology called bivariate symbology, which basically allows us to combine, compare two separate data fields. Okay, so I'm going to pick, you notice that's the option there. And it gives us an option to select the first option, which in our case, let's pick the female age cohort. And the second field here, we're going to choose the male age cohort. Okay. And with that selected, you notice you have what it calls quadrants, and the different quadrants basically represents when you match the two information together, it creates a grid of colors, and the different grids mean different things. And that helps you to easily interpret what it's trying to say to you. I'm going to simplify this grid by using a 2x2 grid so that we have less colors and it's much easier to interpret. So when you look here on the left side, this is what the different colors are trying to tell us. But before I do that, let me change the size of that outline. I think it's a bit too thick, so we can't see what's happening in these areas where the population density is high. Okay. All right. So with these two, with this symbology I've just applied, basically this is what the map is saying. We've combined the two fields sitting within the same layer. So instead of creating two maps and put them side by side and hope that a person will be able to tell it's high here, but it's low here, it combines the two, and then it shows you for the first bar that I'm highlighting on the left side. That's your female between the age of 15 to 24. So from that light, I don't know what it is, light pink to dark pink, that group. And the second one is from that light pink again to the blue, that representing that other male age cohort. So basically how we interpret this is that from here, horizontally, here it's low, your males are low. If you see any color that within any area that has this color, the male population is low. If it's this color, the male population is high. Vertically, same thing. If you see this color on the map, the female population is low, and if you see this color, it is high. However, when you see this color, it actually means for both of the two age cohorts, the population is very high. So in a nutshell, we've just basically applied all the other symbology I've done within one layer. And we're able to actually visualize anywhere where you're going to see this high color, this dark color. It actually means for the two age cohorts, these are most likely areas where you might have a high concentration of that population and most likely high risk of that population. And I don't know if you recall, but this is exactly the same areas where we had identified rural areas that we had classified as villages. Okay, let me see if I can bring up that layer again. Okay, I think I've already changed, but essentially we're now able to say within the whole metro of Etigwini, we know which areas might be a bit problematic in terms of these two age cohorts, following the assumptions of these articles that we've read here. So therefore, we're now able to say, to answer this question, based on the output map, identify potential problem areas. So problem areas are essentially these areas that we've identified here. And we can now create a map that we can print out and put in a report that basically speak to that. And how you go about doing that, I'm gonna try and quickly make a quick map. Just to show you that there's nothing that is complicated about GIS. Any data set you have, you can manipulate to answer the questions you want to create. So this is how I want my map to look like. Usually a map would have things like a scale bar. So I'm just gonna add a scale bar to the right side. And it will have an north arrow. So I'm just gonna take a sample here. And alongside that, you might have things. Another thing that's quite important is your legend. Your legend explains what you're seeing in the map. Okay. And you can go add things such as title, which you can place anywhere you want on the map. And when you're finished, you can actually go and export the map, and you're able to export it as an image, PDF, and so forth. Remember, this now ends up sitting on your file. You can print it out, and you have a final map that yeah, that's pretty much a map that you can put in a report printout. But remember, it's a static map. And I think that concludes this section here. And with that said, I'm going to move to the next section, where we are going to focus on some of the ideas Dr. Domen did share that we have applied GIS in. One main thing you're going to notice from what I just demonstrated, creating a map, the difference between this and the previous one is that the data set here, it's GIS, but it's live and interactive. So in other words, you can package data set in a way that you are able to, a user who doesn't know how to use GIS, they don't have to go and create maps on their own. You can just create it according to how they want it to appear, how they want it to be displayed or to be used. Okay, so that's some of the stuff. So the main thing here was to spatialize COVID-19 vaccination data to guide spatial targeting and macro planning for field teams. Okay. Before I get to that, I want to quickly show you all this data set you're going to see. The backbone of it was mainly data set that was collected in the field using mobile devices, and all of it ended up sitting in databases that you can export to Excel. So I'll just show you an example here. This is the file here. It's showing vaccination recorded at settlement level. Okay, so the file is still loading, just give it a few seconds. And basically what it has is the records that were reported on a specific day for a province, a specific geographic area, which contains a district, and it contains a specific municipality or sub-district. And within that sub-district, there's a suburb, or there's a village, or there's a settlement, or there's a town, whatever you want to call it. And the age groups that were recorded in terms of that were coming to do the vaccination at that specific timestamp. So this particular settlement, for the age group of 12 to 17-year-olds, they had 45 individuals as of this particular date. So if you were to download this data the following day and there was more people from this settlement, maybe 15 more, this figure would have changed, it would have increased by 15. So you notice this data set is actually quite big. If I scroll right to the bottom, you have about 12,000 records. And you can go summarize it by province, each settlement name. So I'm using a pivot table in Excel to manipulate, to change the data set. So then I can now pull the different age groups. Okay, so this is one way this data set was being recorded. However, it was also being recorded at a facility level. So when a person goes to vaccinate, the facility name is recorded, and additional information is also recorded there. So already there's rich data that was being created. So you notice that data set is actually quite big, 24 megs. You can just quickly show you what it looks like. And this is what they're collecting. Again, geographies, so location, your province, your district, sub-district, the facility ID, each facility has a unique ID. And then a site. So a facility sometimes will have an outreach site, will have teams that go out. So all that gets placed under the facility, but you can drill down to a facility level. Remember also, facility belongs in a specific settlement. Okay, and there's a date, the age groups, and we'll have information such as what sort of vaccine type was it, and then if it was a first dose, Pfizer, J&J, how many boosters and so forth. So you can reach it further more and say how many full vaccination doses were actually administered at a specific area at time. Okay, so again, this data set is rich. If I scroll down, and I think this is just for the province of Gauteng, you see you have over 300,000 records. But it's amazing how much data is out there that we can actually manipulate. So if I go to apply pivot table, I can now be able to create simple data set that adds up relevant fields. And now I can now create this within GIS and then share it as a live interactive product. And that's exactly what I'll be touching on next. Just give me a second. Let me just bring up the dashboard. Okay. So this live dashboard is a dashboard that's essentially showing, reflecting vaccination coverage within the specific province. Each province in South Africa has got its own dashboard, and this is mainly meant for program managers and people who are involved within the whole program to support the activity. And what you have here on the first page, that's a summary that's showing them in the past week. This is where we're shifting the needle by this much. Overall, this is how far we are. But the different age groups, this is what's happening. And then these are the highlights, the settlements where we're seeing numbers changing quite a lot. So every week this changes, okay? On the left side here, you see something that's just showing basic information on how to use this. But more importantly, you have a map here. This map is live. You do not need any GIS skills to use this. So hence our program managers also and so forth, they don't have experience in GIS, so they don't need to go into ArcGIS to create this, but they can come here and answer a lot of questions to do with the vaccination progress, like Dr. Doman did mention. So on the map here, you notice I can actually zoom in, zoom out. When I zoom in, certain layers, information is displayed. The same thing you're able to see on Google Maps and navigate pretty much. But here also you have this data. This data is linked to the map. Okay, right to the bottom, you also see a number of different tabs. And the different tabs, again, it's drawn from the same vaccination data and census data here. Here we have got school enrollment stats. And we've got a few other tools also that we can use to manipulate. And I'll just quickly touch on some of these tools shortly. And then other things such as graphs, and then reports that is generated from the same analysis that program managers can use at a granular level to go decide. This is where we're identifying demand that still needs to be met. And yeah, so let me quickly touch on the different things that we have here. So within this province, we have a summary of how the health sub-districts. So you have a district at the top. You can see the bold outline, and it has 1, 2, 3, 4, 5, 6 sub-districts. So you notice an option to filter to that sub-district, City of Tshwane. So if I click on that, the system actually goes and filters everything for the user. They don't need to go and do searches and so forth. So it brings up the words there, it brings up the settlements and how the settlements are performing. They can now go and say within the worst performing sub-settlement, which is right at the top, and the best performer right at the bottom. Let's pick the second worst performer. I can click on this. Again, it's all linked to the map. It's linked to everything we have on our right side. So I'm able to see within this sub-district, this is what's happening, this is the performance. These are the words within that sub-district. So the different colors, as we see here, actually mean something. They're talking about levels of coverage in terms of how many people have we managed to reach. I did want to see colors that are green and blue, but obviously you can see some areas they're still that maroon color. So your coverage is between 0 and 5%, and your orange or red is between 5 and 10%. So what they eventually end up doing is to say, okay, this is our sub-district you're managing. Let's see which areas we're having clusters of settlements where performance might be poor. Okay, so they're able to use this to then go make decisions based on what you're seeing here. They can still take this step a bit further, where they're going to say within the sub-district, actually, it seems like we've reached X number of learners, but the schools in the area report about X number of students. So you notice here we have more learners that have been reached more than the schools in the area. And that's because you have migration, kids who stay, they reside in this sub-district here and they go to school here and so forth. So hence the numbers might not match. However, the biggest thing that usually alarms us is when this number is way smaller than what we have here, and then there's a problem. If it looks like this, it actually says they've been doing very well in terms of reaching the numbers within the sub-district. They can take this a step further, where they are now able to interact with this map, okay? And say Team B is deciding that next week we need to start planning activities around this area, okay? I want to see a summary of a cluster of settlements around this, because I can see the settlement is performing quite bad. But what is the actual target population will be reaching out to? We have a population with the settlements, but we can't look at the settlement alone. We actually need to look at it in the context of its neighbors. So they are able to go and say, okay, let me use a tool where I can select a group of settlements around that settlement. So we create a cluster of that settlement. We end up selecting that. And then we are able to see your gray bars is how many people we've actually vaccinated. Your blue bar is if you are to add up all these bars for these different age cohorts, it gives us 38,000 people. But in actual fact, when you look at census data, the population within this area is about 178,000. So they're able to say that, look, we actually have a serious problem here. We have a huge population. This bar should at least be at 70%, which is somewhere around here. So there is something that needs to be done in this particular area, okay? And then you can see in the past week, we only shifted the needle by about 44 new people who are vaccinated. It's gonna take, I don't know how many more years before we even reach 70-something%. And therefore, they can create demand acceleration strategies that goes and creates demand in the area before the vaccination teams move into that specific area. If I come back to the summaries again, I can see the worst performing settlement here at the top, best performance towards the bottom within that specific area. Another thing they're able to do within the dashboard, we've generated this through the dashboard, is they're able to go and say, we're in the city of Tshwane. Let's have a look at a summary that's sort of placed within a PDF, a PowerPoint summary to see which are the critical areas that we probably need to go focus on in the coming week, okay? So to start off, it will give them, I'm hoping colleagues can actually see this because I see everything looks a bit more. Let me zoom in a bit. A quick summary that says within this district, this is what's happening, okay? This is where we are, this is what the different age, how they're performing. However, we can also pull through to see what are the worst performing areas. So we can do this by different age cohorts. And then here we're able to see if I can zoom into this so we can visualize this a bit better. Okay, let me change it to that. So they're able to say, if we look at the whole total target population, so anybody above the age of 12, within the sub-district Tshwane 1D, in Ward 24, there's a settlement called so this is a total target population, but so far it looks like we've only reached 380 something, which is 0.something%. So this area is an area of interest. We can break it down into different age cohorts, people above the age of 60, which areas are a problem, 50 to 59, 35 to 49, and so forth. And then we take all this information, 1, 2, 3, about 6 tables, we put them into one table and say, look, if we analyze the previous data set, in sub-district 1, in Ward 19, there's a settlement called so-and-so. You have a problem for these age groups. So when you go there with a message that speaks to those age groups, if creating demand or trying to identify what the issues are. Or it will say something like within specific settlement, it seems like we have a problem with your over 60s, all the age groups. So this is how GIS was being used in this particular instance to sort of to inform decision making at a much granular level. And I think that brings me to the end of what I had to present. But just to wrap it up, some key takeaway steps for GIS mapping success. Remember, just define your problem and understand your GIS data. What that sort of data do you require? But the number one thing I usually say is, can you attach location to your data? Is it important for you to do that? If it's important, let's manipulate our data set so that we can be able to do that. Okay. So data preparation, mapping, analyzing, visualize. Take your Excel data set, add columns, attach more data set, use your VLOOKUP, and go take it into GIS. And then finally, there's the preparation of the end user output. So you're creating your maps, or you're creating your maps that it's being printed, or you're publishing online products. Yeah, I think that brings us to the end of what I had in mind in terms of what we had planned to present. A few other things I wanted to touch on before I go is the few things that Dr. Dorman did mention, where we use GIS datasets. Here we have an app based on GIS, the same GIS datasets in South Africa. The user is able to say on their mobile device, I reside in this specific location, somewhere here. I'm just picking a specific random location. I'm willing to travel, say about, let's just say about only 5 kilometers. What vaccination sites are actually open within this area? Okay, so the moment they do that, they're able to see the list. This is the site that's open, but please confirm to check availability. I can go on Google Maps and be able to say, okay, navigate to the location and so forth. Again, GIS being used in the data set, we're just using it to try and, yeah, and ask more questions. Whether it's for the end user to find the location, or we're trying to figure out how do we service the specific population. Yeah, I think I will close right there, and thank you very much.
Thank you so much, Victor. We'll go ahead and get started with the Q&A, and I think Dorman, you might be most prepared to ask the question. We also have a feedback survey, so if as you're listening to the answers of these questions, you can go ahead and fill out that feedback survey for us. Thanks so much. Over to you, Dorman and Victor and Babo. Yeah.
Thanks very much, Melissa. Maybe let me start by picking up some of the questions that have been raised. There are quite a number of questions. Some of them are technical, some of them are related to operational, some are very specific to programs. And I want to respond to probably a question that came in probably towards the end. What was the startup time to set up base GIS environment, identifying, obtaining, cleaning, and loading community boundaries, facility location? I think this is a general question around GIS setup. And the way I would answer this is it depends on the problem that you're trying to resolve, a key takeaway from what Victor said. And it also depends on the experience of the team as well. I could say when we were setting up COVID-19 vaccination support for South Africa, we were actually able to have a demo up and running within 2 to 3 weeks, with information covering settlements, districts, sub-districts, and numbers attached to facilities, and pulling all those multiple data sets in. But however, what then happened was this was refined as we go. So I think probably to address that question, it depends on the problem being set up. Secondly, probably it also depends on where you are working. Generally, what we have picked up is that there are certain countries where a lot of data is available, census data is there, population data is available at the granular level. You have admin boundaries refreshed very regularly, provincial data, facility data, all of these available in digital format. So whatever activity you are supporting, data being available in digital format helps you to set up and run with this very quickly. But again, it depends on the specific context. I hope probably that tries to address the question. The second question I will check before I ask Victor to come through on other questions was a question related to what type of application do you recommend for data collection that properly fits with GIS? And I think this is a very important question because I think this question not only talks to, I think before you start deciding what application for your data collection, maybe you need to look at an entire process end to end, where you are saying, I want to set up my GIS system to be able to collect data in the field. I want this data to be easily loadable into a GIS software where I'm able to quickly do analysis and do simple analysis, complex analysis, and all the advanced analytics. And then probably thirdly, I don't want just to give maps to my foot soldiers or maps to my implementation team or even to my funder. I want my funder to be able to log in online and be able to view the maps in soft copy, i.e. they're able to zoom in and zoom out. If you look at that whole cascade in a holistic way, then you're actually able to decide on a platform that could, number one, help you to actually do the data collection, i.e. you are able to get a module in a GIS environment that helps you to develop a tool for data collection. You have a module that actually then receives that data within a GIS or a platform. And then you have got another part of the platform that is able to serve or share those results with external key stakeholders. And I think in this age of the digital age, I think those are functionalities that give you a leverage. And to now come back to the question, using an example as well, like what we did with the ArcGIS here. Within the Esri environment, if you pick ArcGIS as an example, you actually have the option to develop data collection within the ArcGIS environment using a tool such as Survey 123. With that now, you are able to, once you develop a tool, which you put in the hands of your soldiers who are out in the field, you can deploy that offline, online. That capability resides in the Esri environment, which gives you, again, that edge to say, I want my results in near real time. It means by the end of the day, all activities that happened in the field, you have them sitting on the back end. And then with that, you are now able to run simple analysis, or you can run complex analysis. With that, you're able to build a dashboard where, as changes are happening in the field, like what Victor was saying, showing you, as my vaccinators are vaccinating today, by end of day today, I can know in the dashboard how many vaccinations that they've done. I can talk to productivity. I can talk to course correction. I can manage my program in a very efficient manner. So by choosing the application where you say, I want to look at my data collection and work with this application, look at the entire value chain to say from data collection all the way to result sharing. That way you actually can be able to get one solution that actually has all these components building nicely for you, and you're actually able to build an ecosystem that you can know it's plug and play across the country, across your province, across your district, even across multiple countries as well. Victor, I'll hand over to you. There were some questions around Power BI mapping capabilities versus use of ArcGIS. Which one would you recommend for what, if you are able to take that? And then there was also very specific and technical question on bivariate symbology in QGIS versus ArcGIS. I don't know, Victor, if you want to take those. Thank you.
Thank you, Dr. Thoman. I think the first question on Power BI, I think from my experience, Power BI is great when you dealing with tabular data, a lot of tabular data. It creates amazing, stunning results. And yes, I know you can actually pull in maps and display your data as maps. But again, with regards to the route that we took, ArcGIS provides more advanced way of trying to display your spatial data more than what Power BI is capable of doing. And that's why we took that route. We're able to not only just show tabular data, but we also be able to say, this geographic data is sitting on this. I said a facility is this far from this settlement, schools are this far from the settlement. Based on the geographic relationship of the different data sets, what can you tell us when the three different layers of data are intersecting each other? What are you telling us? So GIS is able to do more capabilities when you're trying to manipulate spatial data than Power BI, from my experience. And also you are actually able to go in the back end and programmatically add more functionalities if need be, customize your own more advanced GIS visualization, or how data can be manipulated. That's to answer that question. The second question was around bivariate symbology. I think the option is available in QGIS. I just haven't used it in QGIS, but I think it is available in QGIS, and I think there's a few resources online that demonstrate how one can use it in QGIS. I'm not sure if I answered that question correctly.
Thanks, Victor. The other key question that I also just want to address is the issue of ArcGIS access and usage of ArcGIS. And I think in the chat, Mayuran, if I got the name correctly, is actually captured that very well in terms, if you are choosing ArcGIS as the route or the way to go for your support, for most not-for-profit support, most countries, they actually have a discounted ArcGIS that they can provide for you depending on your needs. Your starting point now would be to approach your local or regional ESRI distributor and talk to them as a not-for-profit organization and tell them you want to access and use ArcGIS and its supporting tools and softwares for your applications. They should be able to help you. And if you are enrolled on the not-for-profit program, you will definitely or most likely get a discounted price on that software. Victor, there is more questions on some of the things that are related to, I think there was a question on QGIS and whether we will be able to support any QGIS activity. I'm probably going to defer the question, the technical side, I think Victor can answer, but the actual support side, I think that's where Melissa and the team would come through and probably are able to talk to that. Victor, maybe on a technical end, if you want to start.
Yeah, as we had mentioned, I think we use a lot of ArcGIS because fortunately we have the licenses to go manipulate things there. But we also have been trying a lot to start getting into the open source, your QGIS. QGIS, there's a lot of possibilities with a lot of resources that are also shared that one can actually be able to manipulate and get to some of the results that we presented. I think what's we presented here is also possible using the open source route. Yeah, we are exploring different, how do we also represent some of the data set we've created, how can we use open source resources to get the same or similar results. And I think as we also discover some of tricks and whatnot, we can share that. But it is very much possible to use your open source to do that. The same resource, the same information we've shared now, it's possible with open source GIS to share that, particularly based on what you're able to do around QGIS. You can build it up a bit more. It's just that I think with QGIS, you might need to create certain things in QGIS and then go use other third-party open source resources to integrate or to represent it in a different way. Whereas in the ArcGIS, everything is within one sort of, platform. But yeah, it's possible, and it's an area that we're also very much interested in to explore further and see how much more can we get out of it. Thank you.
Thanks, Victor. There was a question, I think this one was generic, so I will address it more on the program side, where the question was, I'm in OVC, which is Orphans and Vulnerable Children Support. I'm supporting key POPs. Will I be able to use GIS to support implementation and targeting in my program? And the answer is yes. I think we have got to a stage where we realize that directly and indirectly, location and locational analytics are part of and parcel of our daily endeavors as we commute to work, as we go to look for a takeaway somewhere. Generally, you find that there is locational analytics that tend to sit on your mobile phone, as well as other gadgets that we are using. So generally, we have come to that stage where we say any problem happens somewhere, and the where part is what drives location. So if I'm running an OVC program, definitely you will be able to implement basic GIS to advanced GIS in terms of supporting your orphans and vulnerable children. By the way, you also need to know where those orphans are, and obviously where are your supporting points for the program. The same with key POPs. If you are supporting key populations, I think we discussed some of those examples where you could even think of participatory mapping, because sometimes you go out to look for data to support your programming and you realize actually nobody has that data. But if you actually go to the audience or the target group that you're trying to interact with, and you put a map before them to say, tell me, your local community, what's happening where here? You will have a whole lot of information that could be the best layer for your GIS to support a key POPs activity. So to answer the program side, I think everything happens somewhere. That's the answer. So you could literally build where location and locational analytics into your programming. But of course, the problem statement must be clearly defined. The value add of GIS must offset the cost that you're going to incur. Thanks for that.
And quickly on the, sorry to jump in, but quickly on the key population mapping, because of the sensitivity around the subject and depending on the country and the policy, you have to be careful how you map it and who you share that data with, right? Our goal is to protect those that population, right? Not to expose them, right? Some of the mapping may have like great insights in terms of program design and implementation, but the way we share it, we have to be careful. We don't want to expose them, right? We don't want to harm people or expose them. And the second point, in terms of, I can give USAID perspective on the use of some open source and commercial as well. I saw Teddy on the list from Kenya and other, I'm sure other USAID country GIS specialists are also on the call. You will always have you have access to them, right? If you're in country, reach out to either the health office GIS analyst or SI person. If you don't have a GIS specialist, you will have one in the program office for sure. right? Make sure that you know the person and reach out, try to brainstorm, oh, I'm trying to do this. What will be the best option or where to get the data? They will have something to share or at least point you to the right direction, right? Now, in terms of where to start, I would always say start with free and low entry. QGIS has been my go-to tool when I can afford to buy a license. But if you can, ArcGIS will be a good thing because they have a lot of free training. The support system is great, but you don't always have to jump to use the big guns for small stuff that you need to do. For Tableau or Power BI, those are considered as a business intelligence tool. They have mapping capability, but if you want to only do, you think that you will be doing only light mapping, I don't think it's worth it. For maybe your own professional development thing, you may get a trial version and try it out and see whether that is something that you want to do. But make sure that mapping is just an add-on to it, right? You are doing more general data visualization analytics, and also being able to share like live dashboard is something that is very critical to your organization. But if you're going to use Tableau or Power BI and at the end of the day do screenshot and put on the PowerPoints, there's no need for it. You can just use QGIS. Excel will give you great visual. Do some touch up in Adobe Illustrator or some open source graphic software, and then that will do it. You don't need to invest too much money and effort into those advanced and big to enterprise level tools. For USAID side, me personally, I've found myself bouncing from QGIS, ArcGIS, Tableau. We have access to Power BI, but we don't use it much. And sometimes I use Python or R for scripting purposes. Like, let's say I want to make like basic map across 68 countries, like all PEPFAR countries. I'm not going to sit there with QGIS clicking through 68 map, right? I'm going to use R with SF packages. It's going to do those mapping very quicker for me. Same thing for Python if you want to do scripting, right? There are a lot of tools there. Just identify where you are at the organization level and the staffing level, and then take it from there and build onto those skills and those tools. I see a lot of hands up and clapping. Thank you for that, for confirming. If you have more information, please add it to the chat. Derman, I'm going to stop here. I wanted to just chime in and provide USAID perspective. Over.
Thank you so much, Baboma, and thanks really for flagging the issue of key POPs. And I think what we also emphasize whenever we deploy sensitive GIS information is to use the geomasking option. That's one thing that also could be discussed further. Geomasking helps you to protect and cover issues that relate to personal information, so that you are able to ensure that we make sure that our citizens are also protected when we know their locations and that information is sitting in our archives. I'm cognizant of the time. Melissa, let me hand back to you. I think from our end, thanks so much.
Great. Thank you so much for facilitating the Q&A. We hope that most of your questions seem to have been answered. Again, the presentation will be shared in the coming days, as well as a recording of this webinar. You can also find the past 3 webinars if you're more interested in strategic information or have more questions about that. There were 3 previous webinars that are relevant to this topic as well, and I've shared the link in the chat. You can go ahead to that resources page and it will provide you with some further information. We'd like to again thank our presenters today for facilitating an excellent webinar, as well as thanking USAID and PEPFAR for supporting and funding these webinars. And we hope you all have a great rest of your day. Thank you so much.
Thank you, Melinda. Thank you, everyone.